Welcome to the Informed Pregnancy Podcast. I'm your host, Dr. Elliot Berlin. This is part 2 of the Double Standard series. I'm here with our co-host, Kira Soltanovich, our guest, Dr. Stuart Fischbein, Sarah Shahi, and Steve Howey. So this nurse comes in. My wife is getting really close to pushing, and the doctor's not going to make it in time. It's just going really fast. He had gone home, and she's on all fours. And this nurse, I'm a big guy. She comes in and makes me feel small. She is ginormous. And she says, okay, honey, let's get over onto your back and open up your legs. And I just was so shocked, but I just turned around and looked at her, and I said, I hope you're talking to me, because she's comfortable in that position. And I thought I would just make that joke and everything would be okay. She was not having it. She's like, no, she's got to get over on her back right now, son. And I was like, I'm 40 years old, son. And I think she was younger than me, but bigger. She was big. Yeah. And we started like going at it. And then the resident came in who was going to catch the baby, and she's like, what's all the heat about? And I said, my wife's comfortable in that position. She's really wants to force her over onto her back. And she's like, I know where the baby's going to come from. I don't care. She can push in any position. And so she stormed off to some other room, that nurse. And, 4 minutes later, the baby just dropped out.
Thank God that there are some people like her.
That resident?
The resident. Yeah, that makes totally all the difference in the world.
She was cool for the whole process. And then we had our fourth baby at home. Just,
Did that resident stay in the community? You remember?
I don't know. I was told. First of all, I'm face blind, so I don't recognize anybody.
Right.
Can I ask a medical question?
Yeah.
If your wife had transitioned and laid down on her back, would that have slowed down labor?
Probably not at that point.
Okay. But
it can. I mean, the whole idea that they went to the hospital when she was 3 centimeters early to get the antibiotic, and then an hour later she's 3 centimeters or 3.5. That would be not surprising at all, because just the getting in your car and driving to the hospital and all that stuff disrupts the whole thing and slows things down, which is sort of why people end up getting Pitocin and ruptured membranes and stuff so easily at the hospital, because hospital isn't designed to have you sitting there doing nothing, but the hospital disrupts the normal mammalian instinct of laboring when you feel safe and secure and unfettered and uninterrupted.
Right.
When any mammal is interrupted, whether it's your dog or a horse or a deer or anything, by a predator or by little kids running in the room, what happens to them? They put out adrenaline. Adrenaline stops the contractions. They get up and they run away. Mm-hmm. That's what mammals do. It's fight or flight. So same thing happens to humans. It's just that the modern medical model doesn't really think of you guys as mammals. They don't think that way. But it's classic. People will be booming along at home. They'll come to the hospital, and then the contractions will be every 8 minutes, and they'll go, well, we got to do something. Now you're here.
Right.
And the something should have been, like what you did, which was very smart, which was go home.
Go to
Although a lot of people don't live 10 minutes from the hospital, so they need to go for a walk or they need to go privately. But that's the beauty of having a doula or a monitorese at home, is to keep you home as long as possible if you're going to go to the hospital, so that when you get to the hospital, you're already in that transition or ready, second stage of labor, where nothing really, nothing's going to stop it at that point, pretty much.
I see that with my doula clients. We're laboring home. They look great. They're strong. They're confident. They're healthy. They're happy. They're just really powering through it. It's intense. It's uncomfortable, but also seemingly somewhat enjoyable. And then all of a sudden, literally within 2 hours of getting to the hospital, some of those clients look frail, pale, and like they're just going to die. And it's not because labor has progressed more, because when we stay home with those clients who are doing home birth, they get even stronger and more excited about it. It's the shift. I think it's the shift of like, you're in that environment where you feel so safe and so relaxed and so unobserved, and things
in
are just
control.
happening. And in control. It's your territory. And then just putting on a hospital gown just, doesn't make you feel all that safe. And peeing in a cup. And I noticed like shoving the emergency shunt into your vein because we think you're going to die, but we might be able to save you.
And don't forget to sign here about surgery and death.
Right.
I mean, none of that
Between
seems
contractions.
like...
I mean, even just like when I first got wheeled up, my husband was parking the car, and so an orderly or somebody wheeled me up, and the woman was like, probably the same one. Was this at Cedars?
Yeah.
Yeah.
Big.
Yeah. I know who you're talking about.
All right.
She's the head nurse, by the way.
Is she?
Yeah.
I'm
the first thing
but I recognize her.
Yeah, the first thing she asked me was like, can I see your insurance? Can I see your ID? And it's like, I'm not checking into a Holiday Inn Express. Like, can we do this? Just, I'm here. I've already pre-registered. Isn't that the whole point?
Do you have your hospital points card?
Get a stamp. The
Can I get
10th
an
baby's
upgrade?
free.
Continental breakfast.
But I did feel immediately that feeling of the defeat. They put you in this mental frame of we are in charge now, which I think is not the right way to treat a woman in labor.
There's a lot of people that are, the anti-home birth people out there speak loudly, and they often talk about, making one of the solutions would be to make the hospital more hospitable or more home-like. We talked briefly about it earlier. You mentioned it earlier. That would be great, except that can never happen.
Right.
Because the policies and procedures of the hospital and their management and administration are not going to let you come there and be yourself. Once you're in their space, get this. If you're laboring at home for 20 hours at home, all right, no one's monitoring that baby, all right? The minute you come into the hospital, all right, now that baby has to be monitored, and they won't even, if you break your bag of waters, they make it difficult for you to even go for a walk. But you walked in with broken bag of waters, and you were home with a broken bag of waters, and no one really was worried about it. But now you're in the hospital. Right. Now the hospital's risk management team thinks that it's, a possible problem, and so therefore we're going to overtreat everybody, which then gets to that point of disempowerment that we were just talking about.
We treat everybody like they are high risk.
Yep.
Everybody.
But let me ask you a question though, because what gave me confidence in her is the realization that women have been doing this for thousands of years. I know her, she was really strong, and she had already made the decision she was going to do that. Absolutely. That her decision gave me confidence. How did the anti-home birth community, I guess if there is one, what do they say to that, about that this has been going on for thousands of years?
So they would just say that people die in childbirth, and
more babies died.
More babies died then, and more mothers died then. And that partially is true. Certainly women bled to death, women hemorrhaged, women lacerated, babies would be stuck in utero, and both mother and baby would die from infection because they couldn't get them out. That's the whole the advent of forceps. And you should look back in the obstetrical history. You look at some of the devices and instruments they had in the late 1800s. And
before the 1890s, they didn't have antiseptics.
Yeah, before Semmelweis, they didn't even have that. But they have these things that would do things to the baby to be able to get it out, not alive, but at least to save the mother. So, the pendulum has swung way too far, because in 1970, which was considered the modern era, the infant mortality and cerebral palsy and all the birth injuries to babies is about the same then as it is now. Nothing's really changed, but the cesarean section rate has gone from 5% to 32%. All right, and we've really got nothing significant to show for it. We've got a loss of skill. And we've got a loss of women, 2, 3, 4 generations of American women who have been taught to believe that their bodies will grow babies that are too big to come out, or that they can't do certain things, or that their body will not function without modern medicine. And the truth is that if you're left alone, the chance of you having a successful birth is much greater. And the likelihood of something going wrong, if you're not meddling, restricting movement, starving a woman, interrupting her, putting her on Pitocin, the chance of something going wrong suddenly, which is everybody's big fear, is much, much smaller. All right? That's why if you select your clients properly for home birth, you don't see that sudden deterioration that you often see in the hospital, which leads to the emergency cesarean section, and thank God we had an operating room because they just saved my baby. Now, sometimes that's true, and certain people belong in the hospital, and we're not here to... none of us in the home birth world really want to bash the hospital. We've been saying things about Nurse Ratched and other things like that, but ultimately the hospital is a great place for certain people. But 85% of women don't necessarily have any problem, and yet they're treated, as you said, as if they have a medical problem.
Even our first 2 births that we did have at the hospital, before we had our home birth, called them home birth at the hospital. I thought they were fine. My wife and I had really good experiences there, but on the 3rd one, there was a lot of pressure to intervene where I didn't see intervention necessary. And by then I had seen home birth. So by the 4th one, we just decided to save the gas and have the baby at home.
Save the
gas.
So you were 32 weeks with baby number 1 and breech. And then you come in, I call you cutie pie, almost get decked. And then what happens?
And then you turned wolf the first time I saw you.
Wolf turned himself.
Oh, Wolf turned himself.
Right.
There we go.
Careful of the language.
In the finesse
there we go.
of my hands. Yeah.
Well, then what did I pay you for then?
I'm just chatting, really. I got you relaxed enough
Okay, for
to
Wolf
let
to turn.
Wolf to turn in more room in your womb. is what we created.
Did you come see him specifically because you were breech at 32 weeks, or had you been seeing him already?
No, it was specifically, it was Davey and Yvonne both sent me to him.
She was trying really hard not to have to come see me.
Would you suggest that women who are breech at 32 weeks start seeing you?
Oh yeah.
I think all women should be seeing chiropractors, but a lot of people say, well, let's just see what happens, and if by 36 weeks the baby hasn't turned, then we'll start sending you to the chiropractor.
That's a good point. We have a whole podcast on breech called Breech 101. Long story short, at 32 weeks, approximately 90% of babies are already head down. At birth, 96 to 97% of babies are head down. So more than half of the babies that are breech at 32 weeks will be head down. Just over half at birth. So there's not, a reason to panic at that point. But at 32 weeks, we get more like 90% of our babies to get head down. So it is a bit of an insurance policy. And then also, if you wait till you're 36 or 37, then it's really hard to get them head down. We still have a fairly good success rate, but it's a lot lower than 90%. So the Webster technique also that we use for breech babies, chiropractic technique to improve the function of the mother's pelvis and create more functional space for the baby to turn, is not a breech turning technique. It's just a pelvic improving technique. And when you have a more functional pelvis, babies are more likely to want to and be able to get head down. So there's no reason not to do it at 32 weeks. The external version, the medical procedure, has some side effects, significant potential side effects associated with it that
and cost.
And cost.
Right.
Well, we're not cheap.
No. I'm saying that I thought you were talking about external version.
The external version. I'm saying the chiropractic is not. It's an expense as well, but it's we don't have the risks associated with it that would make us want to wait till the baby's at full term.
Well, I as a birth practitioner would think that my clients who do see chiropractors often do have easier times with their labors. They often the babies are in better position. I just think that, even though the Webster technique is supposedly for breech babies, I don't see why you wouldn't use it on pretty much every pregnant woman.
It's not specifically for breech babies. He developed
but
it.
People think it is. That's
people
what I'm
think
saying.
it is because so many babies turn after we do it. But Dr. Webster developed it because he basically had this pelvic paradox. So sometimes you have this really small baby in a nice, healthy pelvis that just gets stuck on the way out. And sometimes you have this big baby in a tiny little pelvis that just comes through very smoothly. What's going on there? We're not looking at function. In pelvimetry, we're looking at size of the pelvis versus size of the baby, but that's static. There's function in a pelvis that's functional and dynamic. It can open up, it can expand and contract like a rubber band, letting a basketball through, and the baby's head goes from like 12, 13 centimeters down to 9 centimeters. That's dynamic. You can't see that on a picture. But with chiropractic, the concept for Webster was if you had a more stretchy rubber band, then the basketball would be able to get through easier. That's what he was trying to accomplish. But after doing it on a whole bunch of women who were breech, their babies started to turn. So we do it, but you don't have to wait till the end. We do it all pregnancy long.
What's the main difference between the two?
Between what two?
There are two techniques, right?
Oh, the chiropractic technique is about improving the muscles. Well, it's really the ligaments and joints of the pelvis. If the joints are stuck and don't move, you have a kind of a pelvis that resists babies moving around inside them. If you have a pelvis that's very dynamic and moves around a lot, I'm moving my hands like people can see me on this podcast. If you have a pelvis that moves around a lot, then it can accommodate the baby's movements better. What the medical approach is to physically try to, through the belly, try to force the baby into the ideal position.
Oh, I see what you're saying.
And what are those side effects?
Why don't you talk about the side effects?
Well, again, it depends on which world you live in. If you live in the fear-based medical world, the side effect that everybody's worried about is causing a placenta to separate early, or injuring the baby, or causing a cord entanglement, or something that the baby's heart rate will go down and won't come back up, and you need an emergency cesarean section. Now, I know that happens, but weird things do happen. I've been doing versions for 30 years and never seen that happen. But that's part of the reason that when you do a version at a hospital, you end up basically being a medical operative procedure. A lot of times they're giving you an epidural. They give you something to relax your uterus. You have an IV. You have an OR crew standing by. It's a setup for failure. When you think about, if I were a woman, how am I going to relax in that setting?
I know. That's why I thought, I'm
Right.
like, geez, I would maybe go into labor.
The first time I saw one, I was like, where's the guy with the flame retardant, just in case she spontaneously combusts? I was worried.
Now, I understand that that's the model by which they care for people. And so that's what they do. They would think that, well, first of all, they think pretty much everything that I do is out there near
hocus
Pluto.
pocus.
But well, I do versions in the office or people's homes. And I don't use medication. And we often use hypnosis. Mm-hmm. And, we...
So that they believe the baby has turned?
No, so they bark like a dog. And then the dogs, they can deliver either.
Every time they hear a dog barking, baby turns
around. No, and I would say the success rate's about the same. And again, you also have to select your clients properly for that too. Mm-hmm. I mean, if you have a woman who's having her first baby who's 39 weeks and the baby's frank breech and 8 pounds and she has very little fluid, the chance of that baby turning with a version is extremely small. You have a woman having her third baby who's 38 weeks with an 8-pound baby and her abdomen is much softer and the success rate is pretty much significant, which is sort of, it's an interesting phenomenon. I'll just digress for just a second. Of the breeches that I've done at home, 85 to 86% of them have been first-time moms, what we call primips. And only about 14% have been multips. And so the question is why? And well, the answer is it's a lot of the multips, it's easy to turn their babies to head down so you don't see it. What's freaky about that is that there are a few breech centers around the country that are beginning to form, and there's one in Portland, Oregon. I think there's one in San Francisco. The odd thing is that they won't do primip breeches. I mean, they won't allow primip breeches to deliver to labor. They'll section them. But the whole idea, if 85% of your breeches are going to be primips and you're not going to allow them to labor, then you're not diminishing the cesarean section rate, and you're not doing. I mean, what's the point?
I think one of those. I think one of those breech centers that will only do multips right now, they're getting their feet wet. Their comfort zone. They're more comfortable with multips because there's already been a vaginal birth. The odds of a baby getting stuck on the way through are a bit less. And so, you have the corporate higher up liability team saying, don't do this, don't do this, don't do this. And I said, well, what if we start with these moms that already had vaginal birth?
What about tri-tips?
Delicious.
What's the success rate of tri-tips?
Those are delicious
My
babies.
hospital doesn't allow tri-tips.
My first kid was 10 pounds. He was almost like a tri-tip.
Wow.
Yeah.
10 pounds?
Boom. Through the lobby.
Supersize me.
The first one, yeah.
That's a big
so
baby.
3 hours wasn't so bad.
No, it's not bad.
Right. He was probably 9 pounds when he started pushing.
Yeah.
I love it.
We are going to take a quick commercial break. Don't go anywhere. We'll be right back. Sarah, when did you and Steve, when did you guys meet Dr. Stu?
We met Dr. Stu. It was
It was
I'll
windy.
tell you exactly.
Windy?
It was windy. It was sunny. There was not a lot of clouds out.
It was like late July, and I was in New York, and I had come to LA for Comic-Con. And I remember I called you and I said, I need a guy.
Oh,
I need a guy with like a wand, like one of those ultrasound things to confirm a pregnancy. I peed on the stick. It's positive. I just want the confirmation.
Let me back up for a second. You had your first baby at home with a midwife.
That's right.
Yeah.
Okay, so you met Dr. Stu
Through you.
in relation
Because
to
midwives don't do ultrasounds. So
Well, that's right. Midwives
Well, I'm
don't do
just saying-
ultrasounds. And also, I was in New York, and I was coming back
Oh,
to
you were
LA.
filming in New York?
That's right. I was filming in New York, and then I was coming back to LA.
So we have to confirm that my swimmers work.
Right. So
What did you think? You thought you might be pregnant? Or
no.
you were trying?
I
You were
peed on the
wanting
stick.
to?
I was
Okay.
pregnant. I went to the urgent care that was across from my apartment
In New York.
in New York. And I was coming to LA for the weekend for more work, and I called you and I said, hey, I need a guy with an ultrasound. I need him to just tell me that I'm pregnant and that there's really something going on in there. And you sent me 2 names. Rothbart. What's his name?
He's my associate.
That's right. You sent me his name and Dr. Stuart Fischbein. But I saw their names and I'm like Rothbart and I'm like Fischbein. What's a Fischbein? I'm like, I've got to meet Fischbein. I'm like, what is this? I'm like, I've never heard that name before.
delicious.
Yeah, but they're both Jewish doctors, so you couldn't go wrong either way, right?
But
What?
still,
Fischbein
look,
is Jewish?
My last name is I sometimes I notice people with unusual last names because my last name is Shahi. That's my
All right,
real
slow the F
legal
down.
last name. So when I see an unusual last name,
Can you say that one
I'm
more
like,
time?
what is that?
Yeah, really. Say it again.
Does that even fit on Twitter?
No.
It's what? Say it again.
Jahansu Shahi.
So
just
Shahi's a...
Spit just hit my eye.
Ah! It made a left and then a hard right.
Jahansu Sushi? Yeah, Jahansu Shahi. And
Mazel tov.
yeah, Mazel tov. So, I made my appointment with Dr. Stu, and I remember going into your office, and I remember I thanked you profuse. I'm like, oh, thank you so much for doing this. I just need a quick confirmation of pregnancy. Dr. Berlin, I got, and you were like, oh, Elliot, I'll do anything for Elliot. Remember when he was like, I love Elliot, I'll do anything for Elliot.
Almost anything.
Yeah.
Don't get any ideas.
I was just getting ideas.
I'm not dealing with Gracie, so don't.
And so he's like, all right, let's see if we can do this the civilized way and not have to go up. So I lay down, and we had our other son, we had Wolf with us at the time. And so we sit down and you put the wand on. And he puts the wand.
We did it
on
on
the
the
belly,
right? So it's
Yeah.
not really a wand. It's like a
What's it called?
Transducer.
Transducer.
Wand would imply sort of
Internal.
going up the
the lobby.
Yeah.
Through the
Yeah.
lobby.
Going
the
up
lobby.
the AHA. Going up the AHA.
You were more in the penthouse.
So we
listeners
put
to be
the
clear on
transformer. What's it? Translucer?
Transducer.
Transducer. We put that on the belly. The wand. We put it on the belly, and this was his first reaction. He went, ugh. And he looked away from me. And I was like, what was that? What was that? Like he split his eye contact with me. He looked away from me. And I went, what happened? What is that? What's going on? And
then he threw up the peace sign.
And then he turned back and he threw up the peace sign. 2. And I didn't get it. I was like, what do you mean? I'm like, what is this?
I never really know how to tell somebody that when they're,
yeah, what were you,
So I turned away because I'm thinking like, well, do I come with a funny thing? Do I come with a straight line? Do I,
Haven't you been doing this long enough to know?
Yeah, but I didn't know you guys.
Right.
I mean, I just met you.
It was the
Yeah.
first time meeting
So
you.
Yeah.
and then Steve,
I got it.
he literally he got it. I didn't get it, but he got it, and he jumped so high. I've never seen him jump so high. His knees almost hit his chin. And then he started hyperventilating in the corner. Do you remember this? You grabbed the wall and you kneeled over and squatted and started breathing really heavily. And I'm looking at him going, what the fuck is he doing? Why is he doing that? And Dr. Stu still hasn't said twins to me yet. So I'm like, what the fuck is going on with all these weirdos in this office right now?
It wasn't really that much time didn't pass, just so you know.
Right, but it felt like
Your
it.
mind
It felt
did,
like
yeah,
it.
Right.
It was 2
No
years
offense.
later.
I am a storyteller.
No offense, but the proposal, nothing made sense to you. This, nothing made sense to you. Why does it take you? So you're like, what's going on, everybody?
It was just not in my reality. It was
would it have
not
helped
in my
if he
reality.
just took 2 pies and right in your face?
So then he said twins. Dr. Stu said twins.
What the fuck? What the fuck? What the fuck?
He didn't make twin. Why are you getting mad at the doctor? It wasn't his fault.
I got mad that he told me. And then
And I was like, babe.
yeah, you grabbed my ankles because I was laying down. And then go ahead.
And then I was just like, babe, calm down. And you're like, no, what the fuck?
And then that's when I went, you did this to me.
Yeah.
And
plug
then
my special.
That's right. And then,
Except that's how twins are.
that's
Twins
right.
are made that
And
way.
then that's when
It's your own fault.
Dr. Stu said it's not his fault. He inserts a million guys. This was you. And he was like, you did this all by yourself. You dropped an extra egg.
Those damn legs in the
You
air.
dropped the egg on me. Wow.
And then I got on a flight to go back to work for the next 6 months, about 2 hours after that doctor's appointment.
Wow.
Can you drop an extra egg by doing the leg in the air?
I don't
No.
think so.
No, it has to be growing during the weeks before that.
Can you will it?
She could
With
probably.
hypnosis?
Yeah.
Because she did.
Hypnofertility?
You wanted twins?
No,
No, but I remember there was a moment. I did not want twins, but I remember there was a moment when I was standing on the corner of Times Square and I remember I was just like, twins. That'd be cool. I wonder what that would be like. And then that was it. That was the only kind of.
No, but before that, you wanted to get pregnant.
Oh, I was so baby ready.
So you think she was so into it, she just like overdid it?
Yeah, she willed it. She
Yeah.
willed it.
But look, I'm so glad they're here. I wouldn't have it any other way. But
No, it's
I
yeah,
wanna
and then I
know-
got on a plane and 2 hours later, and it just never. It took forever for it to sink in. It still doesn't sink in.
I
I'm
have
looking at both of
selfies.
them. Yeah, I worked on a show and I had to do a lot of stunts, and I told them I didn't want to do the stunts because I didn't want
Oh,
to
you
do
didn't tell
anything
me
to
you were
harm my
pregnant.
babies. And
Oh, you did?
No, I did tell them. It was like a series of bombs I was dropping. Like the first one was, "Hey guys, I think I'm pregnant," and they're like, "Oh, that doesn't work for your character," and I'm like,
'Cause you're so
"Yeah,
physical.
but it works for my life." And then they're like, "Okay, well, let us know when you know for sure." I'm like, "Okay, I'm going to LA this weekend, and I'll let you know."
Oh.
Then it's like, "Hey, so I'm having twins," and my doctor says I need to be wrapped by a certain date, and that took a long time for them to get because I remember they had lawyers calling you, or they had the Warner Brothers doctor call you. They had a few.
To figure out what the date was?
Vaguely.
Yeah, they didn't.
But when she should probably stop
It was when I was 6
doing
months.
stunts.
Oh, doing stunts. You were still doing
Well,
stunts?
no, it was
No,
when I
I'm-
should stop
she should
working.
stop working.
But
squibs on the stomach.
they
Ooh.
wanted me to. Yeah, I don't know if you guys know what squibs are, but they're just
Fake
little.
bullets, right?
They're
Well,
they're little
Kind of.
explosives
They're mini explosives
that have fake blood pouches in front of it.
Right.
So when they explode, it
it
looks like you got
you've been
shot.
Yeah.
But
They're little explosives.
and they wanted me to squib my belly when I was 5.5 months pregnant.
I have
That makes
a.
sense. That makes sense.
Right. Exactly. Yeah.
That makes sense,
So anyway, we didn't, and it was very different. And the thing is I'm really grateful that I have had these different pregnancies because, I remember, the thought of being pregnant sounded so alien to me. And then I got pregnant with one baby, and then having it at home just sounded so far-fetched. And then I had it at home. And then the idea of having twins, it's like, who has twins? Like, what? That's suicide. And then I had twins. Then you have them at home. It's like, what? And then I did that. And so it's like, I'm grateful to be able to talk about this, to hopefully encourage people or inspire people, to do something that they feel like they couldn't
to drop
do.
an extra egg.
To drop the extra
Will
egg.
it, man. Will it.
But yeah, but it was very different. Like with the first one, I worked out every day. He was 40 plus 2 days late. And I walked 5 miles a day when I couldn't work out anymore. And I was just walked. With the twins, it happened. I got big so quickly.
How'd you hide that in your work?
In the show,
Yeah.
they just did because I didn't gain anything. From
Holding a lot of
here.
grocery bags.
No,
Oh.
so it was just they just kept the shots
Camera.
tight.
When you say here, you mean like chest up.
Oh yeah, that's what, yeah. Sorry again. So, but I couldn't work out. I really had to let it go. I couldn't work out. I remember I started going for like long walks, and I think I called you, and I'm like, I called Yvonne. I called somebody, and I said these contractions, like it's just happening. I don't feel comfortable. They're like, then just stop. You're, high risk because you have two. Just stop. If you're feeling uncomfortable, listen to your body.
Listen.
Like, just don't give it up.
Also, when you're pregnant and you already have kids or a kid, everything changes. You don't have time to take care of yourself as much.
You don't,
You
yeah.
don't. You just can't.
Yeah.
It's impossible. It's a different world.
Yeah, and then I get to, the part where I'm, 30 plus weeks now, and I'm just huge. I'm very big. I mean, when I was about 4 months pregnant, people were like, any day now, huh? And, and so now at 30 something weeks, I was just big. And walking was uncomfortable, sitting was uncomfortable, breathing was uncomfortable, driving was everything was just, and I kept asking Doc, I'm like, should I be on bed rest? And, he was like, no, you do what you feel like you need, you can. If you feel like you need to put yourself on bed rest, then put yourself on bed rest. So.
Was it twin pregnancy different for you, Steve?
How did it change for you, Steve?
Did you feel bigger?
How was it? Did you want to lie down and be on bed rest?
I was so hard.
He's been on bed rest for a
It
long
was
time.
bigger. No.
No. Okay.
You
We're
were
down to-
together for a lot of it, though, right?
She was in New York. I was taking care of Wolf in LA, and she was in New York.
I had Wolf. I had Wolf.
Back and forth?
Wolf was with me.
Not back and forth?
I don't remember it that way.
Okay. Yeah.
No, I think he did go back and forth. You're right. I think.
I'll set you guys straight. And whatever you need to know about your relationship, just
Yeah.
How was it to be away from him for 12 weeks?
pregnant
Wolf?
with twins. I mean, you had more kids than he had with you than he had with him.
That's right. No, it's awful. Anytime you're away from your
Yeah.
kids, it's horrible. It's the worst.
But what about being away from your husband? Because you didn't mention that part.
Well, she didn't ask me
Okay,
about
I'm
that
just
part.
curious.
No, it was awful. It was all awful because it was, we find out we're having twins and then I'm on a plane leaving. That opportunity to
Same day.
digest this together to, I remember when I had to get an OB in New York just for a couple routine checks, and Dr. Stu helped me find somebody, and you made some phone calls for me, I think. And
Jewish doctor with a funny sounding name?
No, he was an Asian guy.
Oh.
He was the guy in Business of Being Born. He was that guy's associate.
Okay.
Cool.
So
And that guy's Jewish.
Jacques Moritz's partner. I think.
that's right.
Gotcha. Okay.
And like when we were 14 weeks, we wanted to find out the sex. We FaceTime, Wolf and we FaceTime Steve in LA. Remember that? And that's when he was like, 3 lines. I think it's a girl. And
Oh, it
no,
sounds tight. It sounds like a really touching FaceTime moment. Yeah.
no. How was it different for you? I mean, how much of this stuff does affect men? I'm
That's what
always
I want to know.
curious,
That's
like
where my
how-
question is. Was it
Yeah.
different for you, second pregnancy with the twins versus the first pregnancy with one baby?
After the first one was born, it was really hard for me just because everything was so different. That her and I had, it was just hard. It was like, because now it's like there's 3. And so we were both working. So any energy that was left over went to the baby.
Oh, so you guys just, okay. Like a lot of couples.
A lot of couples,
Like
yeah.
not so much.
No
towards
more
each
of
other.
us. It's all there.
It's all
And
going
it was
to the
just
kids.
Like, what is going on?
So it's not even necessarily because it was twins. It was just like that.
It was, and so what happened, I think, is that we got to a good place years after that, and then so I was nervous. I was excited. I was nervous, excited. The days were long and short at the same time, and so it was all getting ready for blast off, and like, how was it going to happen? And then looking back on it, it was great. It was great.
The pregnancy was great, or the birth
pregnancy
was
was great. Yeah. I mean,
great? Did you guys bond a lot over the fact that you're having this unique twins experience?
Yeah.
Yeah, that was really nice.
That was
It was
really-
hard being in New York because we couldn't bond. And there was and I was so nauseous and so sick, and I had nobody with me to, it was just me by myself. So any kind of midnight runs to go get pickles or whatever it was, I mean, that was me having to do everything. And I was working 16 hours a day, and it was just, and fighting battles at work. Like, no, I'm not going to do that stunt. Like, no, I'm pregnant. I told you, bring the stunt double. And so that was a whole other set of politics I was having to deal with on top of this. And I was by myself, and it was just,
The squibs?
Squibs.
Squibs.
And so some of our friends are also clients of Dr. Fischbein's, and PJ and Deb Fiddler. And they had twin girls at home.
I've never heard of them before.
And
More than 4 hours apart, actually.
that's right. That's right.
That's
Same
last,
day?
Last time I'm doing that. Yeah, that was the same day.
And they had sex at 36 weeks, and the twins came the next day. And I was so uncomfortable. I'm like, these babies are coming out. Like, I remember I texted Dr. Stu, and I'm like, if I have sex and go into labor at 35 and like 6 days, will you deliver? And he went, yes. He's like, but I remember you were just like, yes, but these babies are going to come when they want to come. Like, and I'm like, I'm trying it. So we're like trying to have sex one day. It was awful. It was
Twister.
It was Twister. That's exactly right. It was the opposite
Actually,
of what it.
Twister might have done it.
Right, Twister
Yeah.
might have done
Yeah.
it. Twister would
Might have been better.
And then,
with some
and then now,
directions.
and at that point, I was 36 weeks. No, I was almost 36 weeks. And then March 1st,
And then March
I'm
1st,
37 and 2 days.
it all of a sudden started hailing.
What?
The thunder came. It was lightning, and Wolf ran outside, put his jacket on, and boom, the lightning struck, and it started hailing. And I can't remember. It was one of you that said the barometric pressure.
It was Yvonne.
Oh, it was Yvonne.
Yeah.
Sorry, yeah. It was the barometric pressure started it, and then like right after the hail happened, all hail broke loose upstairs, and you just heard, Steve! And so I ran upstairs, and you were just screaming. She was just screaming at me.
Well,
Is it true that the weather can do that? That the weather can affect labor?
I think there are people that believe that. I think there are people that believe that full moons can do that, and that a rapid change in barometric pressure, if it, can do that. I don't know that there's any data to support that.
What are you talking about? You're a licensed medical doctor and an advocate of a chiropractor. Of course you believe.
But I went water skiing the day they had astrology, so I missed that
geometry and astrology.
Yeah, sorry about
You
that.
probably suck at Tetris.
Actually,
Yeah.
I used to skip class to go water skiing, by the way, in medical school.
But did your water break?
It was
Is that why you
it
were
was one of
screaming?
those. I remember I went upstairs to our bathroom to go. I just had to go pee, and I was I was going pee, and it was literally it went boom, and right as that popped, my bag broke.
We are going to take a quick commercial break. Don't go anywhere. We'll be right back. Oh, really?
It happened
Wow.
simultaneously.
You were like in
It was
touch with
not
the earth.
like-
You
it
might have
was-
been struck by lightning and not known it. Is that
possibly.
what happened?
Wow.
But it wasn't like
So no
the hail
twister.
came
No
down
twister at
and then
that
my
point.
bag broke. It happened. It was simultaneously
With Mother Earth.
with Mother Earth, and then the bag broke.
Have you
and
been
I-
in thunderstorms since then?
Yes, and no bags.
Nothing.
Nothing. has
No.
You
happened.
want to
Okay.
pee a little bit?
Unfortunately, not.
No.
No. But no, and then he was in the garage.
He is Steve.
He being Steve was in the garage, and I went downstairs and I said, my water broke. And he was on top of a ladder, and he went, okay, all right.
I was fixing a noose.
For who?
And then,
Oh, that's funny.
yeah, I tried to, I went back, I texted Dr. Stu, and I texted Yvonne and
Yeah.
Beth. And I think you said you were in Century City, or you tried to make your way. You said you were going to wait in your office or something. You
For traffic or something?
Yeah,
Was
yeah.
it like,
Something. It was
3, 4, 5 in the afternoon. Was
And
it?
Dr. Stu asked
I don't
me,
remember.
yeah.
Okay, how far along is she? Is she close? And then you heard her scream, and you go, okay, she's close. So I'm on my way.
Well, it was one of those things. I mean, again, with the second pregnancy, it was just, it happened so fast. I mean, the first or second contraction were pushing contractions. They
Yeah.
were not.
Oh, right out of the gate.
Yeah.
Well, at
these-
this point, because you had breech issues again with the twins.
Yeah. So the girl, I forgot her name, Violet, was, she was head down. She was baby A. She was on the bottom. She was head down, and Knox had always been breech.
Always.
And yeah, so we knew that going in that's what we were looking at.
So Dr. Stu, for you, there was nothing there contraindicated to a natural birth or to a home birth,
No.
even if this was a first time pregnancy.
No, it wouldn't. As long as some simple rules for twins for me. Obviously, I'm not the norm,
Yes.
but they need to be term, so about 35 weeks,
Yeah.
5 days or something like that. And they should be concordant, which is basically they should be within about 20% of each other by estimated fetal weight, which is done by ultrasound. And first baby, what I like to say needs to be in what I call a longitudinal lie, which means that the baby either needs to be head down or it needs to be breech down in a proper breech position that would be okay for a singleton. So complete or frank breech.
Okay, so butt down.
And then as far as baby B goes, I really don't care what position baby B is in.
Why?
Because I'm trained to deliver baby B. If baby B won't come down by him or herself, either breech or head down, or the baby gets into trouble, I'm trained to reach up and grab him by the feet and pull him out.
Because the door's already open.
because Violet has done the lion's. Well, actually, Wolf did the lion's share of the work.
Really?
Well,
It
whoa,
doesn't-
whoa, whoa.
Hey.
I think Steve did the lion's share of the work.
But
Yeah.
wait a minute.
That's why you went so fast. That's why you went so. We talked about second babies.
But in
It's
terms
because-
of the pathway being clear for Knox, the breech baby,
Baby B.
baby B, that was cleared by Wolf?
No,
6
no.
years
The
ago?
fact that Violet came so quickly
That's
was
right.
cleared
Right.
by Wolf, and
So baby B could be footling breech.
I don't try to turn. Yeah, I don't try to turn
doesn't matter.
babies at that point. Yeah, because if it's a footling breech, as long as even we don't rupture the membranes right away, which is why there was 2 hours between. Somebody asked. I think you asked earlier, Kira. Is that normal? And generally, and then we went off on a tangent. And I think it's not normal because in the hospital setting with twins, you're in an operating room, and you have the pediatric team, the NICU team. You got a bunch of nurses there. You got the anesthesiologist there. You got the doctor there. You usually have an assistant or a resident or somebody else. You got all these people in the room. So twin A comes out. They clamp the cord. They maybe let it pulsate for a while, but they don't wait for a very long time. They cut the cord. They leave the clamp on. And then because everybody's waiting, what I was taught was you reach up with an amnio hook, which is a little plastic thing. You break the bag of waters of the second twin. And then if the twin comes, then you have her push.
Do you have to wait for thunder and lightning to break the water?
No.
Or you can do it at any point? Okay.
No, then you don't have to.
You don't have to.
But see, the problem was the operating theaters at Cedars are so soundproof that you
don't hear
wouldn't
it.
know that it was, unless there was an earthquake, then you might feel it moving. And then you break the bag of waters, and then if it's head first, you have the mother push even if she's not ready. And if it's foot breech or whatever else, then you would just reach up and do a breech extraction. That's how twins were normally delivered in the hospital. That's how I learned that, so the twins are generally 3, 4, 5, 6 minutes apart at the hospital and not
Hours.
an hour
2
or
hours
even
apart,
half an
yeah.
hour or 2 hours or 4 hours. From
So
dad-
your
dad and
baby
BJ.
was a boy. Was
No,
a
baby
girl.
A was Violet.
Violet.
And she came out, and I think this is important to talk about because I used to be fearful of this until we went through it. And Steve can talk more about it than I can because I was so out of it when this happened. But the cord was wrapped around her neck twice. Violet's was. And
Why were you out of it? Because was it not a quick labor?
it was a very quick labor, but I think I was just...
She's in the mode.
was
You know,
just
you're
texting,
trying,
yeah.
you know
on
how it is. It's
Twitter.
just like...
Yeah, you were distracted
No,
by.
she was in the tub. She was in the
Insta-
tub into the zone.
I was in the tub. I was in the zone. Violet came out. You know, you know how it is. It's just,
Yeah,
you're
I know
you're still in
exactly
that
how it
zone.
is.
You know how it is. And
So what was really cool is that for Wolf, I got to hold him first.
Okay.
you kind of delivered when Wolf was born.
Pretty much.
Davey took your hands and you
And
pulled him
I-
out, and he was kicking and screaming. Wolf came out kicking and screaming. Okay.
And then when Violet came out, same on all. Sarah was on all fours.
I got to
in the
back up.
tub.
Wolf, first pregnancy.
Yes.
Wolf
Singleton
first pregnancy,
baby.
Singleton baby.
Davey is the female midwife who attended your birth.
Yes.
Steve catches
Yes. I catch
Wolf,
Wolf.
kicking and screaming.
Yes.
Flash forward a couple of years.
A lot of years.
Now
Violet's the first
lot of
of
years.
baby A.
5 years.
5.5 years.
5
years.
years.
and much different. Violet came out blue, not breathing, and limp. And the cord
was wrapped.
and right when I saw the cord on her neck, I immediately started peeling the cord back, and it was taut. It was very tight around her neck. And this is when, my life was flashing before my eyes. Beth, the midwife, took Violet, baby A, and started wiping her face and put her and turned Sarah around and put Violet on Sarah's chest. And I'm watching this, and then Yvonne, our doula, sees this and says, "Steve, everything's fine. She's still getting life. The umbilical cord is attached. This is okay. This is fine," because she sees.
You're panicking.
Oh yeah, I have the 1,000-yard stare. I remember it vividly.
But it's interesting because you said you instinctively started to pull the cord off the baby's neck.
Well, yeah. I mean, it was wrapped around twice,
And
so
right,
it was one of those like
all tangled
maneuver
up.
the baby so you can get a little bit of slack to get it around.
But
her
what
head.
I love is you weren't fearful to do that. Your instincts just...
That was it. It was
Took
all
You
over.
didn't even
instincts.
think about it. It was
You
just
didn't,
instinct. You didn't go to
So-
medical school.
And then
You
yeah,
didn't, you didn't ask
I don't
Dr.
think
Stu,
Have you
what
ever
should I do?
played
You
a
just-
doctor on TV?
not well.
Not
no,
even. Not even that.
close. I mean, I played a patient, but
Oh, well,
that makes
maybe that's where it
sense.
comes
Yeah,
from.
yeah.
HMO care.
So, but what happened is Beth, our midwife, was wiping her face, saying, "Come on, girl. Come on, baby girl. Come on, baby girl. Come on, baby girl." And there's nothing was happening. And then after Dr. Stu was monitoring Knox and like checked out Sarah, he focused his attention to Violet, and he went right to her foot and started flicking the bottom of her foot. And all of a sudden, color started coming back to her. And then she just did this. And then right when she did this faint little, that blue, it was like a purplish blue, just went into like a red and orange. And then it was like a light pink. And it was like, it was amazing.
That concludes part 2 of our Double Standard podcast. Be sure to share with your friends and visit us at informedpregnancy.com for other great pre- and postnatal information. And make sure to come back for part 3, the final portion of this discussion on twins and other types of birth.